Good morning, everybody. In New South Wales overnight, and Dr. Chant will provide details of this, we had 7 cases. 2 of them were from hotel quarantine, and 1 was the guard that was mentioned yesterday, so an additional 4 from community transmission. New South Wales is doing okay, but we need all of us to be vigilant, and I want to thank the 19,500 people that got tested in the last 24 hours. That is really positive, and especially in southwestern and western Sydney, we really need people to come forward and get tested. In the daily brief that I received today, it was noted again that we're concerned about the level of community transmission, which may be actually happening in southwestern and western Sydney, and we really need people in those areas in particular to come forward and get tested. Thank you to those that have, but even with the milder symptoms, if you're from Western Sydney or southwestern Sydney, please get tested and stay home for 14 days if you're told to do so. It's so important for us to make sure we stay on top of it. Can I also please thank everybody who has taken the health advice in relation to wearing masks. The briefing I had from Service New South Wales demonstrates there is greater take-up of masks, especially in hospitality venues where people are working in that environment. And can we please in particular encourage hospitality venues, so people who work in cafes, restaurants, hotels, clubs, to make sure their staff are encouraged to wear masks. The take-up has been pretty positive in the last few weeks, but that is an area where we would like to see people wearing masks. Obviously to protect the staff, but also to protect the patrons, because unlike other venues where there might be casual contacts, if you're actually in one of those venues, you're likely to be there for a longer period of time. And we want to make sure that the staff, but also the patrons, are given every opportunity to protect themselves from the virus spreading, and that is really critical and really important. Again, New South Wales continues to hold the line. We continue to make sure we reduce the spread as much as possible. But as was reported yesterday, and as Dr. Chant has been saying, we do have around 15 or 16 cases that we've experienced in the last 6 weeks that still don't have a confirmed source. They're part of the same strain, but they don't have a confirmed source as to where the virus was acquired, and for that reason, we're really encouraging people in southwest and western Sydney to come forward and get tested. Dr. Chan?
Thank you, Premier. So there were 7 cases of COVID were diagnosed in the 24 hours to 8 p.m. last night, bringing the total number of cases in New South Wales to 3,777. There were 19,414 tests reported in the 24 hours. Of the 7 new cases reported to 8 p.m. last night, 2 are returned travellers in hotel quarantine, 1 from overseas and 1 from Victoria. 5 are locally acquired, including 1 who is a close contact of a previously reported case whose source is still under investigation. 1 case is from southwestern Sydney whose source is currently under investigation, and 1 case is a household contact of this case. 1 case is from Western Sydney whose source is currently under investigation, and 1 case is a household contact of this case. So I've been reporting each day that on average we have about 1 or 2 cases, predominantly from southwestern Sydney and Western Sydney, where the source is unclear. This means that there is the potential for chains of transmission to be occurring in southwestern Sydney and Western Sydney. So can I echo the Premier's calls for anyone in that area to please present for testing? As indicated, we're not wanting you to wait for 3 days or to see if the symptoms resolve. We urge you to come out on day 1 of symptoms. However minimal those symptoms are, please come forward and get tested. That will help us identify any chains of transmission, take appropriate public health action, and contribute to our ability to suppress the virus transmission down to that level of no community transmission. I would also like to remind people that the security worker that we had previously alerted you to, had worked at Flemington Markets whilst infectious, and we're advising that anyone who attended the Flemington Markets at the following times should monitor for symptoms and self-isolate and get tested for COVID if symptoms appear. That's Sunday the 9th of August from 8 a.m. to 4 p.m, Tuesday the 11th of August from 10:30 to 6 a.m. on Wednesday the 12th of August, and Wednesday the 12th of August from 10:30 p.m. to 01:40 a.m. on Thursday the 13th of August. In terms of patients in ICU, we currently have 8 patients in intensive care and 5 are ventilated. 87% of our 115 COVID cases are being treated by New South Wales in non-acute and out-of-hospital care services. So thank you.
Questions?
Dr. Chant, can I just go through the cases? So you listed 4 of the locally acquired cases. What was the 5th locally acquired case?
There were 5 locally acquired cases, 1 who's a close contact of a previously reported case whose source is still under investigation. 1's a case from southwestern Sydney whose source is currently under investigation, and 1 was a household contact of a case, and 1 was a case from Western Sydney whose source is currently under investigation, and 1 case is a wholesale contact of this case. What we're observing, and this has been a pattern over the last couple of days, is often both household members are presenting for testing concurrently. We attribute 1 to being locally acquired without an unidentified source based on the symptom onset, so whichever one acquired it first, and then clearly the second case becomes a household contact linked to that first case.
The security guard wasn't in there?
No, the security card was previously notified over the weekend and appeared in the weekend numbers, and as I said, there were 2 returned travellers in hotel quarantine, 1 from overseas and 1 from Victoria.
Any further word on sequencing of any of those cases been linked to the outbreak from the security guard? Has anybody reported from him?
We would not believe that the movement's crossed over at this point. That genome sequencing is being prioritised, but at the moment we have not got any results. As you can see, that we use the genome sequencing and prioritise these samples to determine that.
Why are security guards contracted to the high-risk setting of hotel quarantine able to work in other settings like the populated Wellington markets and the Parramatta local tour?
Well, can I make this point very clear? It's actually been a miracle that we haven't had anyone contract the virus in that setting before now. We've welcomed from overseas around 48,000 Australians. We also know that 2,000 people in New South Wales have acquired the disease from overseas. So it's been a tremendous effort that we haven't had a case yet. And I'll get Deputy Commissioner Warboys to also comment on this, but we have to accept that whether you're a police officer or anybody else, you are asked to do multiple things, sometimes high risk. You might be a police officer who's working on hotel quarantine one day, you might be on border protection the next day, you might be doing another duty another day. The key message is no matter what job you have, once you feel a symptom, please stay home or get tested and stay home for 14 days. And that's what this guard did. And can I please stress that without divulging too much information, that there's no evidence to suggest this person did the wrong thing at all. They did the right thing at all stages. But we have to accept that there are jobs now in the community that are higher risk, and that's a reality. But you also can't say to somebody, if you work in a particular environment, you can't go to a restaurant, you can't go shopping. I mean, all those things, whether you're working or going to any other venues, that is a risk. And that's why the message to everybody is, no matter where you work, no matter what you do, if you have a symptom, get tested. And if you're asked to stay home for 14 days, stay home for 14 dayou. And that is the key message here, because we have to accept that whether you're a health worker, whether you're a police officer, whether you have another job in society, whilst we live with COVID, all of us have to be on guard, all of us have to be careful about what we're doing. And I'm just, again, relieved that until this point in time, after having processed nearly 48,000 people, that this is the first case. And I want to commend Health for getting on top of this within a day. I mean, I think it was 30 hours, where they were able to identify the strain, they were able to identify the issue and then take action, and that's what's needed. But let's make sure that we approach this virus logically, that we approach it in a positive way in terms of what we need to do. If the health advice changes, we'll obviously take that on board. But all the advice I've received from police and from Health says to us that the current settings we have are the right settings. But we also have to accept that these are high-risk activities, that all of us are in high risk. Every time any of us leave the house, especially if we live in southwest and Western Sydney, we have to assume we're being exposed to the virus. And we have to make that assumption every day, which is why I'm really, really asking and urging people in southwest and Western Sydney to come forward and get tested, because we know the chances of the disease not circulating in those regions is zero. We know the disease is out there. Our job is to try and find it, isolate it and stop the spread. We know it's 100% fact the disease is out there and circulating. Our job is to stop it, to stop the spread.
But isn't the point that these are dangerous jobs that carry risks? The state opposition is saying that if a guard is working at a quarantine hotel, they shouldn't be working anywhere else. Is that something the government would consider? But
if you continue that logic, what you're saying is that if you work in a high-risk activity, and we know that for aged care homes there is that the guidelines exist. So aged care homes, because they're working with very vulnerable people, have an exception. But what that logic says that if you're a police officer or someone working in hotel quarantine, that you shouldn't be doing anything else, because you could spread the virus just by going to your local supermarket. It doesn't mean employment or non-employment isn't the issue. The issue is that anyone who has the virus can spread it to a number of other people no matter what they're doing. And we don't want people to have a false sense of security. You leave the house, you are exposed, especially if you live in southwestern and Western Sydney. So we need to apply good logic and good policy, but also appreciate, of course, there are risky activity, but also that many people who are working in many areas are not restricted from getting on with their lives, going shopping or going for a meal. So the key message we need to get across from a health perspective is please do not go to work if you have a scratchy throat, a sniffle. Even the mildest symptom could mean you have the virus. In fact, because we know the flu numbers are low, and Health gave this advice out yesterday and the day before, Dr. Chant spoke about this, please don't assume you have a cold or the flu. Assume you have COVID. Come forward and get tested. That is the best advice.
2 days before the symptoms show, so that logic isn't going to help in this situation, is it?
Well, we will always follow the health advice, but the logic then says that if you work in any environment, if you're a health worker, if you're a police officer, if you're someone in quarantine, the logic would then say go to work and don't leave the house. The health advice doesn't suggest that at this stage. So we're trying to apply the best logic. And can I please ask everybody to put this into perspective? We've had 47,000 people come through quarantine. We've had day in and day out many staff, police officers, security officers, health officers, transport workers. We've had a myriad, thousands of people involved in this process. And the fact that this is the first case, of course, is a concern, but it also means we have to approach this in a logical way to make sure we take the health advice. If the health advice changes, of course, we'll adopt those changes, but we have to make sure that we let people know the main way we can counter the virus is by making sure that people with the mildest of symptoms stay home and get tested and stay home. I'm sorry?
How did he get it?
Well, I'll ask Dr. Chant to explain that. Actually, both Deputy Commissioner Warboys and Dr. Chant have given me an update, but who'd like to go
But
first?
before you do that, I
Yep.
mean, having security guards, I mean, we know what happened in Victoria. Does that concern you?
No, it doesn't.
Where there has been a breakdown here involves a security guard.
Well, I wouldn't assume that the breakdown. What we need to assume is that this virus is extremely contagious, and even sharing a surface, even touching the same counter or touching the same doorknob, you might not even have been in contact with anybody. You might have zero interaction, and from what I understand, there's no evidence there's been any interaction. So it could very well be a surface. And even when you have the best practices in place, this virus is extremely contagious. So every time we have a case, we assess it, we assess the risk, we assess the circumstances, but it would be improper for me or the government to make decisions based on one case or based on one set of circumstances. We are doing well in New South Wales, and I'm not going to risk that by changing course because of perceived concerns. We have to work on health advice and logic. And when I look back on this time, I want to make sure every decision we took was based on the right decision, not based on perception or anything else. I'll ask Dr. Chant and maybe Deputy Commissioner Warboys to also say a few words on this issue to give everybody confidence about our processes, but also say, please know, one thing that I'm incredibly proud of during this process, there's a few of them, is from day one, police have been in charge of this process. The New South Wales Police Force has been in charge of this process, and I am eternally and will be eternally grateful for their efforts. It is why New South Wales has been able to process more than 47,000 people. And until Melbourne stopped processing hotel quarantine return travellers, they'd done about 20,000, so less than half. So just to put things into perspective, it is a big task. And can I also make this point before I hand to Dr. Chant and Deputy Commissioner Warboys? A lot of those people returning to Australia are not citizens of New South Wales. They live in other states. But because we bear the brunt of, well, we bear most of the flights coming into Sydney, we are doing that on behalf of the nation. With Melbourne out of the picture, Sydney's pretty much picking up the load. And if we don't do it, number one, you won't have Australians being able to come back home. And secondly, those international flights will get cancelled. And so I know we bear that responsibility and we do it well. So I just wanted to put all that into perspective.
So before I begin, I think it's very appropriate that I just caution us about speculation. I think it's critical that we work through this methodically and investigate a range of hypotheses. We shouldn't have tunnel vision when we're approaching this. So obviously we're looking at points of overlap that where the guard may have been when in vicinity of the infected passengers that were diagnosed, and let me tell you, that was 2 individuals. It was initially 1, and then there was 2 people in the room, and the other person became infected. And so we've obviously got to explore the infectiousness and the movements of both of those. But they were in the same room, and they were moved out of the hotel on the 5th of August, as I indicated yesterday. So the 2 scenarios we're investigating is at points of overlap with the guard with either of those people, and also whether there could have been another case, an intermediate case. So whether the contact could have been with someone else and that person's followed on. And this is just our usual lines. We need to keep a very open mind. But can I just indicate that the security guard has been incredibly cooperative, and as have the cases, and both confirm a good understanding of isolation, the PPE requirements. There is no overt contact that we can demonstrate. We have reviewed CCTV footage of the times of overlap, and there's nothing that gives us an easy explanation for how transmission occurred. And that is why it's so critical that we maintain an open mind and consider all possibilities as we attempt to focus on how transmission occurred. I'd also like to say that we are taking, in terms of the concern about this event, we are taking, as we have with all of the other cases, a wide-ranging view of who could have been the source, and we're screening anyone who worked at the Maritime, at this Marriott hotel between the 31st of the 7th and the 14th of 8th, and we're screening them at the Maritime Museum. This highlights the fact that as per our usual investigations, we're casting a wide net, not taking any particular view and taking a very precautionary approach. In terms of my concern about this case, as I said at yesterday's press conference, it's important we keep this in proportion. I'm equally as concerned, if not more concerned, about the transmission in southwestern Sydney and western Sydney, where we continue to have 1 or 2 cases every day pop up where we don't have an obvious source. For me, it's essential that we work with the communities of southwestern Sydney and western Sydney to get people to come forward for testing, support them to get tested, and ensure that we rapidly isolate the cases and quarantine any contacts and break any further chains of transmission. And so I just also would like this case to be put in that broader perspective.
I'll just get Deputy Commissioner Warboys to comment.
Thank
as
you,
well.
Premier. Dr. Chan, good morning. I think people should take a great deal of comfort the way that the hotel quarantine has been set up from day one. We have New South Wales Police, we have Australian Defence Force and also private security in each of those hotels on the ground working with a supervisory capacity across each of those groups of people, reporting back to the Police Operations Centre on a daily basis. As the Premier has outlined, we're approaching 48,000 people now, plus all of the shifts that have been worked there with police, ADF, security, cleaners, people at front reception, people who are cooking meals. If you look at all of that in terms of people that are coming through the police hotel quarantine arrangement, I think the fact that we have one case that we're talking about here today in a security guard is remarkable in anyone's language. I'd also say that we're working very hard with health and contact tracing. The police themselves reviewing CCTV and asking a number of questions around exactly how the disease became apparent in the security guard. But we are, very confident that the two people inside the hotel and the security guard are being very open and forthright, not just with health but with police as well. And I think that just goes to show that that really no stone will be left unturned as we try and find out exactly how this occurred.
Deputy Commissioner, while I've got you there, may I please ask you, will there be any changes in how COVID-19 response operations are run out of this building, considering that the bushfire season is now beginning, and will it remain the COVID-19 war room?
Yeah, so certainly that has been worked through over the last month or so with the Rural Fire Service. As the CEACON, representing all the combat agencies and functional areas, I have absolutely no doubt that this facility here can look after both of those arrangements moving into the fire season.
These two people have got the virus. Did they have any direct contact with this guy? Did he carry their bags? Is there anything putting them in the one room or close together?
From every single piece of investigation with health, with New South Wales Police, there is absolutely no evidence or piece of information that suggests that anything inappropriate has occurred between the two people in quarantine and the guard.
I don't mean to be inappropriate, but do they have any contact? I don't mean to be inappropriate.
No, there's
Do they cross paths?
certainly the guard was on the same floor. There's absolutely no doubt about that in terms of a shift. But there is no contact that we can see, nor has been offered to us by the two women nor the guard.
Premier, if they did nothing wrong and there was nothing inappropriate, no direct contact, but the virus still leaked out, surely that means there's something wrong with the system, doesn't it?
Absolutely not. But what it does mean, and I want to make this point very clear, is that every single case of COVID is a concern in New South Wales. Every single case can spread it in multiple venues and multiple times. Every single case. The fact that this was a security guard, of course, is of concern. But so are all the other. What worries me most is the 16 cases we can't trace back. Fortunately, the health detectives here were able to, through genomics, get this particular strain from the United States, which this guard has. But what concerns us is, given there hasn't been any confirmation between contact between the guard and apart from the guard working on the same floor, is there somebody else that's given them the virus? Or is there another thing we've overlooked? That is more of a concern to us. Or was it transmitted from a surface or other type of transmission? And that's what the health detectives are doing, that's what the police are doing. And I want to thank everybody involved. But I want to stress, every single case of COVID is absolutely a concern, but more so is every case of COVID that we don't know about. And that's why we need to maintain the high rates of testing in southwestern and Western Sydney. What really concerns me the most in terms of where New South Wales is at the moment is that every day we're getting about 1 or 2 cases. They're low numbers, but nonetheless they're cases where we can't link back to an existing cluster yet. I'm not suggesting it won't happen eventually, but whilst they're unknown, we know for a fact that the disease is circulating in southwestern and Western Sydney, and therefore we're making every effort, whether it's getting through different community organisations, getting the message out in different languages. It's really important for people to come forward and get tested to make sure that we control the spread as best we can.
There's another case related to Liverpool Hospital, a patient at Liverpool Hospital. We hadn't heard about Liverpool Hospital for over 2 weeks. Is that a demonstration that it's out there?
Well, it also shows, I'll let Dr. Chant continue because she's the expert, but it also shows that because the incubation period is a fortnight, you may have picked it up some time ago and it was detected later, but I'll let Dr. Chant give a more detailed information.
Certainly that case came to our attention after the reporting figures closed, but there was a case as being confirmed who attended Liverpool Hospital. Close contacts have been identified and advised to isolate for 14 days and get tested for COVID and monitor for symptoms. Deep cleanings occurred in the areas where the outpatient received care, and additional precautionary measures have been taken. This includes testing for COVID staff who worked in the same areas that the patient received care when they were infectious. So again, taking a very precautionary approach. But I would also like to reassure the community that attending hospitals, attending healthcare is safe. Our clinicians have incredibly high standards of infection control, and I am concerned if anyone feels that they are deferring or delaying seeking medical care due to any concerns about acquisition of COVID. I think you might rightly point out that there is COVID circulating in the community, and so the fact that we are seeing cases amongst patients can in fact reflect their community acquisition. But like all things, we keep an open mind about where they've acquired it. You would expect nothing less of us, and so obviously we investigate sources both in the hospital and the broader community amongst their contacts.
Can we just confirm the timeline of those two women too, Dr. Chan, if we can? You told us yesterday that the first positive was the 2nd of August and the second test on the 4th of August. Is that for both of them, or did one test before the other, etc.?
So I believe that the first case developed symptoms prior to the second case. But at the moment so we're not certain whether they're both what we call co-primary, so they've both been exposed overseas and it developed illness concurrently around day 2, because obviously the disease has a different incubation period, or whether they one infected the other. So basically the two of the cases developed symptoms and were infectious around similar points in time.
And both moved out on the
Both moved out on the 5th of August, and but one of them developed symptoms, and as I indicated yesterday, taking that approach, I think I indicated she developed symptoms, the first case developed symptoms around the 2nd of August, and taking that approach that they were infectious for 48 hours, we would have seen that on arrival they were potentially infectious.
Are they still in hotel?
They're in hospital quarantine. As I said, they were transferred, as is per our usual process when patients become positive. They are transferred, and that's in order to facilitate care should they need it, medical care.
How are all three doing? Are they okay?
I haven't been advised otherwise. I believe their situation is appropriate. We'll check with them about any information that they're happy to release around their care.
Are they American, or are they
Have you linked the two Thai well restaurants through genetic sequencing now?
So the genetic sequencing is similar or of the same sort of pool. One of the issues we're dealing with at the moment is there's not a lot of genetic variability in the virus. And so we are still working, and we will be working with Victoria and our experts. At the moment, I'm just seeking clarification about whether we can actually say they're all from the seeding from the Crossroads, the original seeding, or whether we can rule out separate seeding events in terms of multiple introductions into that area. At the moment, I'm not clear that we can absolutely say for certain it was all related to one single introduction.
Dr. Chair, on community sports organisations changes, if we can just get you to clarify, how do you determine the region sports teams have to play within? Is it local government areas?
So at the moment we're working through the Office of Sport, and we're working through the major sports. Each of the major sports uses their own terms. And so it's very important that we work with those major sporting organisations and give that guidance tailored to the terms they use. So that's in process, and we hope to have some clarification out to sports groups. But if I can just articulate the key principles. At this point in time, we are not wanting to have significant mixing between rural areas and metropolitan Sydney. And even within metropolitan Sydney, we're just not wanting to avoid some of those mixing events which take people across areas in metropolitan Sydney.
In cancelling sport, if you look at the
So it's clear that we're not cancelling sport.
Some schools don't are now.
So obviously schools have to make their own decisions about what they're doing. Our advice is that we support, I strongly support the role of sport in keeping children healthy and engaged. We're saying at the moment, could we just please pause this regional interactions? Could we cease a number of activities at schools which present greater risk of COVID transmission? And the fundamental aim is this is a setting we're pursuing for term 3. If we can work with the community to be confident that we have suppressed sufficiently and achieved almost no community transmission, then we'll be reassessing that towards the end of term 4. But what we've been experiencing is the number of introductions into schools was increasing, and
has there been any transmission between people playing sport?
Yes, we do. We do have some evidence that there has been transmission through those networks.
Are you looking at a distance on?
Not necessarily with sports. Can I just say, you know, some of the activities that are a consequence of sport is things like carpooling. It's the social interactions on the sidelines, and so the whole process of sport involves many activities, not necessarily on the field, and obviously it's very complex, but clearly some of those activities are also called out in our advice. And we have reiterated our advice around some of the behaviours we noticed. So every time we have some new information from our personal experience with the investigations, we then share that so people can reflect.
Premier, could I please ask you?
You know where the Tangara started?
No, we have an idea of where it was introduced into the school, but we don't know where that person who's connected it into the school acquired it. Again, our detectives are continuing their investigations, and sometimes it is delayed because we need to sometimes do serology. We need to wait 2 weeks or more for serology to be valid, because otherwise people don't mount an immune response. And so sometimes these investigations are not able to be finalised for 3 or 4 weeks after the original cluster.
Dr. Chan, there's an enormous amount of disappointment about the cancellation of formals and of graduations. Formals perhaps understandable, dancing, all of that sort of celebratory work, but really graduation, why cancel graduation? Such a critical thing for a young person.
So I'd actually like to give some hope to those Year 12 students out there. As I said, this is the setting for term 3, and we are really optimistic with the response the community's had. So whilst we've been talking about the need to increase testing, I've got to indicate my gratitude, the fact that our testing rates have generally held up pretty well. And we know it's actually a hard slog to get people to come out time and time again to get tested. And I really extend my appreciation to the community. So I've got a degree of optimism that if we all work together, we can actually suppress this. The actions we've taken to prevent further seeding events from Victoria, the fact that the Victorian numbers are declining, and pleasingly, there also seems to be a stabilisation in their numbers in regional Victoria, although we're very watchful, gives us some degree of comfort that the measures put in place are having an impact, and that hopefully by term 4 the picture across Australia will be a different one.
That's good, because there's a petition now, which just started overnight with HSC students, I suspect, and parents. I mean, it's blowing up 15,000 straight away.
Yeah.
And a couple of things they do raise is, why make the announcement in the middle of their HSC trial?
Can I just...
Secondly,
yeah.
they also say that you can have 300 at a club, 150 at a corporate event, you can go to a shopping centre, why can't, or could they have these ceremonies in multi-staged situations that you could have children and their parents?
Can I just clarify what Dr. Chant said? The policies we've put in place around those events is to make sure that there's as little disruption to the HSC as possible. The last thing we want is to add to the stress of students by saying you have to stay home and you can't do an exam. But coming back into term 4, once the HSC is finished, there will be an opportunity for health to consider schools having those ceremonies once the exams are over. So all we're saying now is a postponement, for the next 6 weeks. Let's get through the trials and the HSC. Let's let everybody focus on getting these students through a very difficult, it's hard enough when you don't have COVID to sit, I still have bad memories about my HSC exams. I'm sure all of us do. And we know and appreciate the stress students are going through. We don't want to add to that stress by having to shut down a school or having to cause disruption during a stressful time. So the health advice is let's protect our senior students. Let's allow them to do the exams. And we are open, health is very open to looking at what happens after that period in term 4. It might mean delaying those things for a couple of months or a couple of weeks. But the important thing is to get the kids through the HSC. We want them to do their best, to not have disruption, and then focus on those events after that's concluded based on the health advice. And it may very well mean you have a sit-down dinner instead of those normal activities, but we hope that the advice at the time will be that that can happen. So I just want to make clear, this isn't the be-all and end-all. This is just to support senior students during a very stressful time, to reduce the chance of disruption, to reduce the chance of the spread, because as you know, every time there's a case in a school, the whole school gets shut down. And if you're a Year 12 student wanting to access your major works or access the support of a teacher or actually attend to an exam, it will cause you stress. And so this is about reducing the stress, about having less disruption for students, and then hopefully once we get through the exam period, health is ongoingly reviewing the advice, and there could be every opportunity to have those events. So I don't want people to think this is the be-all and end-all. This is just to get us through the exam period.
Last questions, please. You were able to release the report into the Ruby Princess on Friday after receiving it that day. Why has the government not released the report from the bushfire inquiry for 3 weeks nearly?
Oh, because we said from the outset, as soon as we received the report, there are several recommendations. I'd asked for that report over a period of time, and we always wanted a few weeks to consider that. It's very separate circumstances, very different situation. I think you would expect the government to thoroughly consider something which had multiple recommendations. I can say that there's an excess of 70 recommendations for us to look at, and it's a different set of circumstances.
Premier, I've just got 2 very quick questions about the borders, if that's okay. Can we start on the southern Victorian border? John Barilaro says he's going down to fix 25 outstanding issues. Are you confident that he can fix those problems? And why has the government waited for 7 weeks to fix those things?
I think everybody would agree that first and foremost, the health of our community is what's most important. And secondly, please know that we've been working with the Victorian government and with all of our authorities, with the federal government, to make sure we get those settings right. But there are always exceptions you have to deal with, always. When you're talking about thousands of people moving across the border every day, which is what we have, of course you're going to have people who might live a couple of kilometres outside of those border communities who want access, and we're assessing all of those. This isn't a simple process. We've never pretended it is. But I have to say that the southern border, people should feel confident that we've been working positively with all the relevant authorities for a long period of time, and that will continue.
And any update on the Christy Simmons story with the cross-border trying to get her back to Queensland?
Look, I believe there's a resolution of that, but I'm just not sure what information she'd be happy for us to share. So I think that's probably best if I think if we could just take that offline. I'm just conscious about patient confidentiality.
I wanted to ask perhaps Premier Berejiklian, but you might have a comment too. Just Queensland hospitals are for Queenslanders. These comments from Anastasia Palaszczuk.
I think what's most important is that all of us in elected positions take care of the health and well-being of our citizens first and foremost, and that includes people who desperately need medical care. For example, the Albury-Wodonga Hospital is primarily in Victoria, and yet most of the people who use that hospital come from New South Wales, and so I think all of us as elected representatives have to put the health and safety of citizens first, and it shouldn't matter which side of the border they're on. If someone needs urgent medical attention, it's our responsibility to make sure they get it.
Premier, those Victorian HSC students who've been allowed to cross the border into New South Wales, the grace period for that ends on Friday. Justin Clancy says he's got a guarantee from your government that can continue to happen permanently. Is that your position?
Whatever Justin says is the position, because he is on the ground every day and has been working with all of our relevant colleagues to make sure he makes the disruption to his community as least as possible.
Premier, just last question, if that's okay. Yesterday, last one. John Barilaro said the Queensland Premier's decision to shut the border there is a political one. Do you agree with him?
Oh, I've already referred to the comments I made earlier in this press conference. Thank you.
Thank you.